Okay, so let's go ahead and launch our second part of the presentation. Uh, Here I really want to get into some of the side effects of these medications. Now that we know what class they're in, now that we know how powerful they are, we need to really look into what are some of the effects on our kids' health. So I thought this was back to school special Ritalin. Kind of funny, but not really. But according to the U.S. Centers of Disease Control, ER admissions due to Ritalin abuse numbered over 2,500 in 2004. So that's back in 2004. It is 2016 now, so I guarantee you that number has at least tripled, if not quadrupled. So Ritalin, as we know, is not always the safest substance to be putting into our child. Now, here are some of the effects or side effects of Ritalin. So we're talking about nervousness, we're talking about insomnia, hypersensitivity, anorexia, drowsiness, nausea, blood pressure and pulse changes both up and down, dizziness, palpitations, tachycardia, angina, cardiac arrhythmia, abdominal pain, headache, dyskinesia, weight loss during prolonged therapy, rare cases of Tourette's syndrome. So keep in mind the highest dosed age range for our kids are usually kids under the age of 5. I don't know about you guys, but I don't want my child having any of these symptoms. So Ritalin, Concerta, Adderall, all in the same class, all have the possibility of creating these symptoms in our kids. Now, here's an article in the New York Times talking about how the FDA is starting to strengthen warnings on stimulants. So federal drug regulators have ordered that strong warnings be put on labels of stimulants like Ritalin to caution against their use in adults and children with heart problems, and to alert doctors that the drugs cause one child in 1,000 to experience hallucinations. The new warnings are not as strong as those approved in February by an advisory committee for the Food and Drug Administration, but they significantly strengthen the risk information already on the drugs. So FDA is starting to really crack down on these because of the effects that they're having on our kids. Here we go. On TV, it's becoming an even bigger issue. Back in 2009, effects of ADHD meds. So increased heart rate. We went through that. Blood pressure. It does help with focus and attention, but it comes at a price. Can be a drug of abuse. Small increased risk of sudden death. Why did they put a question mark on the end of that? That's kind of a serious side effect, I would like to think. So here's a story about a mother whose child went skateboarding. He was on Ritalin. He actually had a heart attack and died. And her recommendation is, I would recommend that you listen to our story and closely consider, hopefully you can find an alternative therapy for your child. So there are alternative therapies out there. You do not have to be stuck with a medication. And it does have serious consequences, so no medication should be taken lightly, because every medication, I don't care what it is, has a side effect. Okay, there is neither specific evidence which clearly establishes the mechanism whereby Ritalin produces its mental and behavioral effects on children, nor conclusive evidence regarding how these effects relate to the condition of the central nervous system. Ritalin should not be used in children under 6 years, since safety and efficacy in this age group could not be established. Sufficient data on safety and efficacy of long-term use of Ritalin in children are not yet available. Although a causal relationship has not been established, suppression of growth, weight gain or height, has been reported with the long-term use of stimulants in these children. So this is out of the PDR. What's the PDR? The PDR is kind of an important book. It's called the Physician's Desk Reference. So in your MD's Physician Desk Reference, this is what it says about Ritalin. And it's saying here that no child under the age of 6 should be given Ritalin. Well, we know that the highest dose age range of kids is kids under the age of 5. So that's kind of scary. And not only that, they really don't know why it works. They have no idea. that right there at number 3, sufficient data on safety and efficacy of long-term use of Ritalin in children is not yet available. Yeah, and the alternative to that is kids that are on these stimulants for a long period of time have their growth stunted. They're usually not, they don't have the weight gain or height as a kid that would not be on stimulants. So these are very powerful drugs, and they definitely have side effects. And the scariest part about it is your physician doesn't really know why it works, how it works, and it says in here that it should not be given to kids under the age of 6, which is you think would be common sense, but obviously not. Okay, chronically abusive use can lead to marked tolerance and psychic dependence with varying degrees of abnormal behavior. Frank psychotic episodes can occur. That's out of your PDR again. So some important side effects there to take into account. Though shocked by bizarre shootings in schools, few Americans have noticed how many shooters were among the 6 million kids now on psychotropic drugs. If you go back and look at all of these shootings, definitely the majority of them, the kids were on some sort of psychotropic drugs. Are these directly related? I don't know, but that is very much so significant that the majority of these shootings are being carried out by individuals who are on drugs. So that itself is not really good. As we go through here, I want to talk about some of the alternatives, which is what we're going to get to next. So I'm going to go ahead and stop right there and open up the Facebook feed for questions and comments.